Hi, greetings students. This is me, Dr. Ati Tiwari once again, and today I'm back with another important topic in psychiatry, and it's about mood disorders. And in this, we'll try to learn about bipolar disorder. Okay, so yes, as always, my presentations are especially for your competitive USMLE, PLAB, or NCLEX preparing students. I will always have some questions at the end for your quick recap and your boosting up your confidence with the course. Yes, and without any delay, I'd like to now proceed. Okay, and yes, once you have gone through my videos, you will find starting first aid too easy. Okay, now without any delay, let's proceed. So mood disorder and bipolar disorder. So in this presentation, we'll just try to understand what are mood disorders. That's too simple to understand. And then we'll try to understand what is mania and what is hypomania, and how does mania and hypomania frame into the diagnosis of bipolar 1 and bipolar 2 disorder. Okay, so let's proceed. So mood disorders. Mood disorder is characterized by an abnormal range of moods or internal emotional states and loss of control over them. Severity of moods causes distress and impairment in social and occupational functioning. It includes major depressive disorder, bipolar, dysthymia, and cyclothymic disorders. Episodic superimposed psychotic features. Sometimes the mood disorders come with psychotic features like delusion, hallucinations, disorganized speech or behavior, and may present at any time during mood episodes. Okay, but we have to understand one thing, that psychotic features doesn't come up with hypomania. So if you're saying that a person has hypomania, you don't say that he had hypomania with psychotic features. That automatically is not hypomania. So manic episodes now. Manic episodes, you have to understand first, there's 7 symptoms, okay, which has been easy to remember with a mnemonic as dig fast. So D stands for distractibility, okay. I stands for impulsivity, so that means sex pleasure without regard to consequence, also known as hedonistic behavior. G stands for grandiosity. F stands for flight of ideas. A stands for activity, that is goal directed or agitation, psychomotor agitation, okay. S stands for decreased need for sleep, and finally T stands for talkativeness or pressured speech. So when you diagnose a person with a manic episode, then he or she must have 3 or more of these symptoms. Out of 7, he must have 3 or more of these symptoms for greater than or equals to 1 week. So if a person has 3 or more symptoms out of dig fast and for greater than or equals to 1 week, okay, then we say he or she has a manic episode. Or next criteria is that if a person has 3 or more than 3 symptoms, and let's say he or she hasn't got those symptoms for 1 week but just 3 days, but even if it is in 3 days and that those symptoms were so severe that he or she needed to be hospitalized, then that is also a diagnostic criteria for manic episode, okay. So distinct period of abnormality and persistently elevated, expansive or irritable mood and activity or energy. This is a description of manic episode, and we have already talked about the diagnosis requirement for manic episode. And yes, there is always functional impairment. Now next is hypomanic episode. So hypomanic episode means similar to a manic episode, except mood disturbance is not severe enough to cause marked impairment in social and or occupational functioning or to necessitate hospitalization. Abnormally elevated activity or energy usually present no psychotic features, and it lasts for greater than 4 consecutive days. Here is a short difference, is a table for difference between mania and hypomania. So manic episode means marked functional impairment. So maybe the patient cannot go to the school or go to the job, and so there is functional impairment. Whereas hypomanic episode, there is no marked impairment. It's a less severe form of mania, so there is no marked impairment. May require hospitalization in manic episode. Not all people require hospitalization because there were 2 criteria. One was greater than 1 week right? And next was hospitalization of the patient when 3 or more than 3 of the symptoms out of dig fast is met. So next is in hypomanic episode, no hospitalization required. In manic episodes, psychotic features possible. In hypomanic, no psychotic features possible. To diagnose a person has a manic episode, the symptoms must be greater than 1 week. And for hypomanic, must be greater than 4 consecutive days. Now let's see. Sometimes USMLE tricks you with these things, okay? If psychosis is present, it's mania, not hypomania. If hospitalization is there, it's always mania, not hypomania. Okay, so again, when you say not hypomania, then you rule out bipolar 2 disorder, which we'll be studying now in few minutes. So if and the duration less than 4 days, so here we wrote that hypomania means greater than 4 consecutive days, mania is greater than 7 consecutive days. Okay, but then what if the person has those 3 or more than 3 of the symptoms out of dig fast and the duration is less than 4 days? Okay, because greater than 4, greater than 7, so 4 to 7 days, 4 to 6 days, and 7 or more days. So what if the person has the symptoms for less than 4 days? Then we don't diagnose them as maniac or hypomaniac. Okay, because that is considered as normal mood variation unless the patient gets hospitalized. Okay, so if the duration is less than 4 days, then that is neither mania nor hypomania unless the person is hospitalized with those dig fast symptoms. Now let's understand what is bipolar disorder, what is bipolar 1, bipolar 2, and what is cyclothymic disorder. So now starting with bipolar 1 disorder, it requires one type of episode. If a person has mania, okay, sometimes we get confused what is mania and what is bipolar. So if a person has simple mania, then he can be a bipolar 1 disorder patient. Okay, he doesn't need to have depression. Just a mania makes a person a bipolar 1 disorder patient. Okay, so 1 or greater than 1 manic episode plus minus a hypomanic or depressive episode may be separated by any length of time. So this is bipolar 1 disorder. So if a person has one manic episode, fine, he is bipolar 1 disorder. If a person has 1 manic episode and 1 depressive episode, he is a bipolar 1 disorder patient. Okay, next is bipolar 2 disorder, requires 2 types of episodes. One must be hypomanic. In bipolar 2, it's never mania, it's hypomania. So must be hypomanic and depressive episodes. Okay, no history of manic episode, there must not be manic episodes. And next is cyclothymic disorder. So it's a milder form of bipolar disorder, fluctuating between mild depressive and hypomanic episodes. Okay, it must last for greater than or equals to 2 years, with symptoms present at least half of the time, with any remission lasting less than 2 months. So this is the criteria for cyclothymic disorder. You have to remember, if in clinical big need, if you are choosing cyclothymic disorder, this criteria of greater than 2 or equals to 2 years, this must be met, and the person have mild depressive or mild hypomanic episodes. Okay, and yes, with any remission lasting for less than 2 months. Now next is from USMLE point of view. In these videos, I'm not talking much about the pharmacology of bipolar disorder. That will be studying in a different topic, okay, in a different presentation. But yes, from examination point of view, never give antidepressant alone in bipolar. Okay, that is, there will be always risks of triggering mania, and you will frequently be tested on this topic. So they will give you hints, and the person will have manic episode, or let's say 6 months before, and now currently is in depressive episode. Now there will be option which medicine you choose. They don't ever choose antidepressant here unless you know that the person had never had mania. So never use antidepressant. You must always, when a person is in depression episode, always ask for manic episode history. If the person has manic episode history, if you just give now the antidepressant, then the risks of the person going back to mania will significantly increase. So you don't give antidepressant. Rather, in that case, you have to use lithium or some other medicines for mood disorders. Okay, Yes, and lithium is notorious for Epstein anomaly, that is teratogenic seen in first trimester if the person has taken lithium. Valproate is for nutritive defect. Lamotrigine is safest in pregnancy. This question is also asked. A person will be in bipolar disorder, and a lady will be in bipolar disorder, and she is pregnant. Which medicine will you choose? Always choose lamotrigine. Now USMLE practice questions. I have some questions here. You can always pause the video here and then go through the questions, and I hope you will be able to answer these types of questions. These are just moral questions for your USMLE. Okay, so here we are choosing hypomanic episode. Okay, here we are choosing haloperidol plus benzodiazepine for acute mania management, and here we are choosing discuss risks versus benefit, consider tapering lithium with close monitoring. Okay, yes, always take a pause your video here and go through these questions. They provide you with extra tips for your examinations. Next is, if you are preparing for NCLEX examinations, I want you to pause your video here and go through these questions for NCLEX regarding safety and priority, medication and teaching, and assessment, and therapeutic communication. This will again provide you some extra information and make you exam ready. Here we are choosing option provide a calm low stimulant environment and ensure safety. Here we are choosing I can stop taking lithium once I feel better. Okay, and here you say, are you having thoughts of harming yourself? So these are where some of the very important concepts regarding bipolar disorder. So we read what is bipolar disorder, what is mood disorder, what is bipolar 1 and bipolar 2 disorder, what is mania, what is hypomania, how to differentiate between hypomania and mania, how do you remember the symptoms of mania, that is dig fast, and what are the criteria to say a person has a manic episode, what are the criteria to say the person has hypomanic episode. And we also dealt with some of the questions for USMLE and NCLEX preparation. With this, I'd like to end this topic. We'll see you in the next topic. See you. Bye bye.